people don't realize how much game you had at one time. So this is really cool. So thanks for doing that.
I love that concept. How much game you had. Yep, you had game.
I have still have enthusiasm, but the game isn't as good.
Welcome, Kai. Okay, Brendan, glad to see you here.
I'm going to say hi, Kai, too. Good to see you.
Hi, Kai.
I heard that you officially retired. Congratulations. That's amazing.
Yeah, we know it's the dinner hour. That's just fine. And thank you, Andrea, for joining us.
Yeah, and everybody will start in a moment. And again, if you can drop your name in chat, say hi to your friends here or new friends, and let them know what brings you here tonight. What's your association with Santa Rosa Community Health?
Are you asking that just to the people that are coming in now?
Yeah, whoever's coming in.
Yeah. All of our guests to drop in chat. Okay, thanks, Anita. Yeah, Anita on our board, and Bob. Have a couple of other board members who are planning to join us as well. Great.
I think I was on that board at one time. Oh my goodness.
You certainly were. I was on that board with you.
That's right. That's right. I was so clueless. Well, I knew a little bit.
It was the fun, creative Wild West days.
Oh,
making it up as we go along.
It was exciting. It was exciting.
Yeah.
Gosh, Melanie, you started when Southwest had fewer than 100 employees.
I sure did.
Yeah.
It was about 45 employees.
100? Oh my God.
Yeah.
Yeah.
So Adrienne and Elizabeth, remember when we started at Roseland and we wanted to give kids shots, vaccinations. Can you imagine such a thing? Kids couldn't get into school. Kindergartners couldn't get into school unless they had their vaccinations.
Yeah.
And we were contracting with the County Office of Education for nursing services. And our nurse was astounded that she couldn't get in touch with parents because they didn't have telephones. Well, I said to her, they're poor. They don't have phones. And at any rate, we then contracted with Sonoma County People for Economic Opportunity. And they were incredible. Then we had like nurses that were hired by PEO to then provide healthcare, some healthcare in the school district. And that's how I got, connected with Helga Lemke, with Adrienne, and then with Elizabeth. And it all started because we couldn't get kindergarten kids their vaccinations. And here we are, like 400 years later, and people are willing to die not to get vaccinated.
Oh, I know. I gotta say hi to Jadine for a second, though. Jadine.
Yeah, you say hi to Jadine, and then we'll jump in, Naomi.
Hello.
Okay. Oh, it's so glad you could join us tonight.
I am
so delightful.
Computer illiterate to the max, and so I had trouble getting in, but I think
but you did it.
It's so wonderful to see you and Julio and Les.
Is that Jadine Buckholz?
Yes.
Oh,
Jadine.
Hi, Les. How are you?
So good to see you.
And David's here too. Look, here's David.
I am here
my
too,
God.
Les.
Oh my goodness gracious. You were talking earlier about how we were going to do like a signal to stop talking. Well, David was my board president, and he would sit next to me at board meetings, and he would kick me when I'd said enough. He would just, okay, enough, Les.
That's funny.
Well,
I kicked you more often, Les, when someone said something really stupid.
Well, in Roseland, there were a lot of stupid comments made, weren't there, David?
There certainly were.
Well, David and Jadine, I want you to know that you were my shelter in the storm. When I needed some sanity from the craziness, I would go over to your house and talk with you guys, and we'd have a bite to eat. And it was like, okay, I can do this. Jadine and David are sane and they're supportive, and we're going to keep plugging. So thank you for being the shelter in the storm.
Well, that's very kind of you, Les. We think very fondly of you.
Thank you.
So
Likewise.
as you can
Well, you
see,
can tell,
everybody,
yeah.
this is a big
This-
love fest reunion.
Oh my God.
And
Oh.
I want to just take a minute. I need to just share with people how much it warms my heart to see all of you here and go, down memory lane to think about everything we went through together to get everything launched and off and running. And now 25 years later, serving over 40,000 patients with more than
Wow.
500
Oh my
employees.
gosh. Oh my
What you
God.
guys did to
Oh my
start
gosh.
this organization is just nothing short of phenomenal. And I also want to just really say from bottom of my heart how the values and that you established 25 years ago are still guiding us today, that they were such beautiful, well thought out, compassionate ideals and values that they are still our anchors and our North Star and our direction for everything we do. So know that the work and effort not just lives on in sort of operations, but really deeply in spirit and in love and compassion and caring. Not to this whole rebrand work and talk to all 500 of our staff practically. We did all this stuff because our idea of what branding was how to bring the inside out, right? Who are we? And let's share this with the world. And we came up with an organizational rallying cry saying we are united in heart, health, and justice. And I still get little shivers when I say that. It's just like, and I think that really captures everything you meant it to be in those founding years. So such deep gratitude. Every time we have new employee orientation, I share our origin story and I talk about the 6 clinicians who launched this entity. And there's a little line in that presentation that says they listened to their hearts and persisted in their dreams. And I feel like we still do that every day. We listen to our hearts and persist in our dreams to try to make health equity and health justice a reality for everyone in our community. So I just so grateful, and that this legacy that you built is thriving and growing and serving our community. So I want to welcome everybody that to share and learn more about that and learn more about our history. I have to tell you all in about 10 minutes or a little bit less, I had family from Philadelphia arrive today. I mean, and I knew they were coming, but not till about last week. So I'm gonna go host a dinner for family shortly to be with family I haven't seen in 3 years. Oh, Ben just got here. Oh my gosh.
Yeah, well, thank you.
Judy. So anyways, I'll turn it over to the hostess, the MC. Anne-Marie, is that you?
That is me. Yeah.
Let you
thank
guide
you.
the rest of the evening.
Thank you so much, Naomi. Great. And Ben's here. Yeah. And Judy's joined us. And
yes.
So I want to introduce myself. My name is Anne-Marie Brown, and I'm now the Senior Director for Development and Communications at Santa Rosa Community Health, and have the pleasure of working with Naomi and Elisabeth and others. And you know, I had no idea that community health existed. I navigated my career into healthcare, and I thought there's something really fascinating happening in healthcare, and it's just someplace important, and I want to be there. And I felt like I hit the jackpot when I landed at Santa Rosa Community Health. working with this team of people. Many of you have been on that team over time. And so tonight is indeed going to be a love fest. We're going to have more time. We're going to hear some stories and have more time for chats and conversations. And so, you know, we are joined tonight by five of our fabulous co-founders. Jen Hastings, Dr. Jen Hastings and Dr. Julio Porro are co-founders. You can give a little wave. Are co-founders of our Lombardi campus that opened as the Southwest campus on St. Joseph's Day 25 years ago. And also Elisabeth Chicoine, an RN, MSP, and pediatric nurse practitioner, and Adrienne Davis, give a little wave, and Les Crawford. They're all co-founders of the Pediatric Campus, which also opened 25 years ago as the Roseland Children's Health Center. And so as we go through the evening and we invite them to tell their stories, they're going to tell a little bit more about themselves and what's keeping them busy these days. And, you know, our goal is really to learn a little Santa Rosa community health history in honor of our 25th anniversary. Hopefully we'll gather up some food for thought as we go, but above all, really want to have some fun and celebrate the community and rekindle these connections that have made just so many remarkable things possible. When I got to meet the founders, some of them last week for the first time, I felt like, oh, I've met family I didn't even know that I had, but I knew that they were out there. And so that's what tonight is really about. And so with that, all of you who are joining in are part of this community. And so we invite you in the chat to let us know who's here, tell us your name, say hi, and tell your role and affiliation with Santa Rosa Community Health so everybody can hear that. And then of course, as we go through, we want this to be more of an interactive, fun conversation. Drop your questions or comments in the chat, and we'll be watching those. And my lovely co-host, Lori Lynn Hogan, who so many of you know and love, will watch those, and we'll invite those into the conversation as well. So really encourage you to be comfortable, grab a snack, drink your water or beverage. Feel free to stretch and wiggle as you need to stay comfortable in this Zoom space that we're joined in. We wanted to open tonight. We mentioned that we opened on St. Joseph's Day, and we want to start with a few words from our partners, one of our partners at St. Joseph Health, Katie Hillenmeyer, and she's the Director of Mission Integration for St. Joseph Health, now Providence Health. And you may or may not know, some of you certainly do, that Sister Michaela Rock of the Sisters of Orange, who opened and operated St. Joseph's Memorial Hospital, was just instrumental in the opening of Southwest and also Roseland, and kind of connecting this crew of people and helping to make this happen. And the reason Southwest opened on March 19th, St. Joseph's Day, was to honor that connection. And we hope our founders will share some stories of Sister Michaela as we go through the evening. So Lori Lynn, can you tee up that video from Katie? Great.
Greetings, Santa Rosa Community Health Team. My name's Katie Hillenmeyer. I'm the Chief Mission Officer for Providence Health System here in Sonoma County. And it is such a joy to wish you a happy 25th birthday. I'm here in the garden at Santa Rosa Memorial Hospital, where one of the pioneering women who helped to establish your original clinic on Lombardi Court, Sister Michaela Rock, a sister of St. Joseph of Orange, served decades ago. And I want to thank you for the many decades of service to the poor and vulnerable and the least in our community that you as partners have joined hands with us, creating a safety net for people who otherwise would not receive care. So just want to express my deep gratitude to you, our community partners, and best wishes for your continued success and growth. During this COVID pandemic, we've seen in a very stark way what disparities in health access mean for our neighbors in Sonoma County. And you have spent 25 years trying to close that gap. And we are so proud to be part of your roots and part of your team today. Blessings.
So lovely. Yeah, thanks. We so appreciate Katie taking that time, and our friend Dan Sherman, who works so actively with us, who helped to make that possible. So now we're going to dive into the juicy stuff, and here's some stories from our founders. And so first, Julio, I'm going to pick on you first and ask, can you tell us your name, kind of your current engagement, what your role was as a co-founder, and then tell us about how you and Roberto started this crazy thing.
Sure. So my name is Julio Porro. I am retired now. Right after I left Santa Rosa, as Anne Marie mentioned, I was one of the co-founders. I was also first medical director at Southwest Community Health Center. So after that, we moved down to Jen Hastings and I, who are partners in life, and actually working on the clinic, did something, created extra magic to bring Jen and me together. But we moved down to Santa Rosa. I went on to be medical director at Salud para la Gente, which is a migrant farm worker clinic in Watsonville. And then after that, for 17 years, I was medical director at a Medi-Cal managed care plan down here, kind of the equivalent of your partnership health plan. We have one down here that serves Santa Cruz, Monterey, and Merced counties. And let's see, I think some of you have heard this story, so I apologize if again, you've heard it before, but when I was a second year resident, I went to a conference in San Francisco that was looking to recruit minority physicians to community health centers all across California. And so my friend and fellow resident from the family practice residency, Roberto Ascaraga, Bob Ascaraga, and I went down, and we were sitting in the audience and we were hearing all these amazing stories from community health centers all across the state, from Golden Valley in Merced County, from Salud para la Gente down in Watsonville, lots of sites in Central Valley and Southern California. And they were really inspiring stories about communities coming together, identifying a need, and then just from the grassroots, leaders in the community coming together, partnering with healthcare providers and helping create these community health centers. So at that moment, I looked at Roberto and said, we can do this. We don't have to go far from Santa Rosa to, find our homes and the kind of work that we wanted to do, which is work in FQHCs. So we went back, and then the next day, which was a Monday, we told all our fellow second year residents at the residency program, and we convinced Jeff Meckler and Jen Hastings to join this group. And I'll kind of cut the story there, but we later were fortunate enough to get Maria Pacheco and Gina Ascaraga and Steve Sharon all to join and get infected by this vision. And then, the amazing stories of connecting with Elisabeth and Adrienne, but I'll let others speak more about that.
Unmute thing. Thanks, Julio. I love thinking about all of our residents that we have now and still with us every year, and them knowing the legacy of Santa Rosa Community Health and thinking about what they might come up with. And you actually teed this up perfectly. I wanted to ask Adrienne, again, tell our friends your name, what's keeping you busy these days in your role as a co-founder, and then talk about how did serendipity show up along the way, and were there any magical connections that happened to help make this successful?
Well, very quickly, I retired from Kaiser Santa Rosa a couple of years ago, and I had a great gift in my final 12, 13 years there of them letting me develop a patient and family-centered care program. And when I left, we had 8 patient advisory councils and about 100 patient advisors. And it was an incredibly amazing way and to work with patients. And it really aligned with my belief that we cannot improve or even have good healthcare without patients being our authentic partners. And before I left, I've had breast cancer, and our Cancer Patient Advisory Council said, well, you're retiring, won't you join us as a patient advisor? And I went, that sounds fun. And then in the meantime, this wonderful group was trying to develop a cancer peer mentor program, because a lot of us who've had cancer realized when our treatment stopped or other things happened, we felt very alone or scared. And a lot of our patients said they would have liked a mentor. So they asked me if I would coordinate that. So now I have this great job I'm not paid for, and it's the most fulfilling thing I've probably ever done. And it makes it more fulfilling that I'm doing it as a volunteer. And around the country, actually, similar programs are run by patient volunteers, not by staff. And that's why it's affordable. And so I've been helping to develop our peer mentor program with Kaiser and our patient partners. In terms of magic, so much of working with the Children's Health Center and with what was then Sonoma County People for Economic Opportunity, now is CAP, Community Action Partnership. I wanted to move to Sonoma County, discovered it while pregnant over 30 years ago. And I got this job directing a family planning clinic that back then PEO was running. After about 2 years, I knew I'd be stressed out running a state and federally funded clinic. And before I left, Les and Helga Lemke, both Les Crawford, our visionary superintendent, and also Helga, our executive director, started talking about how can we collaborate and support people who had healthcare needs in one of our most low-income communities. And then I remember speaking with Les, and he was telling me about this nurse practitioner that was trying to come work in the schools and give kids vaccinations that were required and they needed. And I said, why are we only giving vaccinations? Why are we not providing full comprehensive healthcare? Well, I was so lucky. The magic was, in LA, I developed a middle and high school school-based health centers. So I had that experience and saw how important it was to provide comprehensive care, especially in areas of need. And when looking at our families who also didn't have transportation to get over to Sinead or to get their needs met, this was an amazing community. But the magic was to have an executive director and especially a superintendent, Les, who were open to this and wanted this to happen. And then the second magic was, out of nowhere, this woman comes from Sacramento, decides she wants to live in Santa Rosa, named Elisabeth Chicoine, an incredible nurse practitioner, who just went for a job I had, because the other brilliant thing Les did is he said, why don't we also run the health services? So then Elisabeth was the other magical part, because she wasn't that excited about being a school nurse, but she was very excited to work on the school clinic. So I think for me, really the true magic isn't about a building or an organization. It's about the people along the way and what we bring to the table and what our values and our dreams are and how well we work together. So just very quickly, I probably spoke too long, but that's some of the magic I felt started us off. So thanks.
That's beautiful, Adrienne. Thank you. And you're teeing it right up here. Now I'm going to ask Les Crawford. We're going to have you unmute yourself and tell our lovely guests what is keeping you busy today and what your role was back in getting this started. Adrienne already talked about a little bit, and then tell us what what stands out in your, like, what's one memory or a funny story that kind of illustrates what it took to start the Children's Health Center? But we need to get you unmuted first.
Unmute.
There we
Okay,
go.
can you hear me now?
Yes.
Adrienne, that was wonderful. Oh my goodness gracious. I think I owe a debt of gratitude to board members like David, and there were a couple others. Kathy Hofstetter comes to mind. They trusted me and they believed in me, and they saw that I had some skills I didn't even know I had, but they encouraged me to be the best I could. And they knew that I had a good heart and I cared about the kids. So they said, do what you can do, because in every direction in Roseland, there was poverty, there was just a lack of everything. And, you know, I'm this white guy, came from middle class, and I had worked in all middle class schools, and I went to Roseland. And I had this perception that if you work hard, things will work out for you. Well, when I got into a community where there was so much poverty and they weren't all white like me, things didn't work for them. And it made me so angry how the system worked against people of color and people who lived in poverty. So it was my mission then. I was going to change things because it made me freaking angry how people could just disregard that children who were every bit as lovable and needed our help just got left by the wayside. So anyway, I had some really great support from the likes of David and Jay Dean and other board members in Roseland. And they gave me license to go out and see what I could do. And then I was fortunate to run into people like Helga Lemke, Adrienne, and Elisabeth, and we did some remarkable stuff. But you know what? What really makes me so proud is we didn't have a plan. We just knew there was a need. And we tried to figure out then, if there's a hurdle, how do we get around it, get over it? What do we do? How do we do it? And so it was just a building block process. And we built trust. And it was like an adventure we were on, you know, and every step of the way, people would say, well, oh, poor Roseland. Oh, poor Roseland. Don't patronize us. What can you do to help? And I'm thinking about how when we first started, it was really quite simple. We needed to get kids vaccinated in order to be able to enroll in kindergarten, because the state law says if kindergartners, you have to be vaccinated. So we had a tiny little shower room across the multipurpose room at Roseland. So we had beans and rice giveaway if parents would come and bring their kids in and get vaccinated. And Adrienne and Helga and the folks at PEO, they got volunteer doctors and nurses to have like a Saturday clinic where they would then give vaccinations. We had some dentists that did like a real cursory dental check, because the kids were hurting. They were just, God, it was, you know, like you could turn in any direction and there were problems. So we started that way. It's like, oh my God, there is a need. And Elisabeth, I got to give you kudos, because she was like, she would come up with these resources. Well, I know a doctor, or I know a nurse. You do? Okay, this is pretty cool, you know? And so for me, this was like, wow, this is fun, because I actually got to do things that made a really big difference, rather than having to just do with negotiations with teachers who all hated me because they thought everything was just fine in Roseland. So there was this energy and enthusiasm and a purpose to make things better for kids. And there were an awful lot of people who helped make it happen. And, you know, again, I want to pay a lot of credit to like David Buchholz and Jay Dean, because as a superintendent, you can't do squat if you don't have board members who let you be the best you can be and who supports you. And everything doesn't have to work. If you make mistakes, it's okay. Keep working, keep plugging. And that's what I had. I had that support and encouragement, and that you can do it, and we're behind you. And then in the partnerships with PEO, that was remarkable, absolutely remarkable. Helga Lemke, she was fabulous, and all the support services, you know, we worked on Head Start, we had after school programs, we had preschool programs, we had state funded preschool, apples and bananas. So the healthcare was like, we had a belief we could do it. There was a need and we can do it. And I'll share this last thing, makes me so proud, so happy. There were days my job sucked. I mean, I had a lot of stuff that was just obnoxious to do. Personnel and negotiations, a lot of negative. Office was located on the Roseland campus. And I would see children with their moms and walking them across or pushing them in strollers, moms pushing babies in strollers, going over to health clinic. And they were getting health care. They had no idea where that health care came from. And I thought to myself, when I would see them, as God, it's worth it. It is just worth it. That, you know, people who don't have a clue that you had anything to do with having a positive influence on their life. And that's the power of what we can do. So I am so happy to be here. And I wanted to comment on what Naomi was talking about. It's really important to have a history. It's so important because people can assume that it's always been this way. But it took people's lives, and God, we worked hard, and the criticism, and you know that, I mean, it was painful. There's a lot of pain and agony that goes into that stuff. So it's important for people to understand that it took a lot of hard work, a lot of just incredible tenaciousness to get to the point where we are today. So it's like in a relay race, you're running a 440, you only run a fourth of that, and then you pass the baton on.
Right.
And I pass the baton on to some really amazing people. And so all the younger people today working there, pass that baton on to somebody else. Play it forward. Play it forward.
Les, that's perfect. I love hearing your stories, and it's so, when you speak of history, the parallels, right, with things that are happening today are just so incredible. And I want to ask Elisabeth to kind of do the same thing. Tell people what you're up to today and what your role was getting this started, the health center, and then talk about, did you know about the folks over at Southwest, and how did you become connected in this little pool of passionate people?
Let me start with my role now. I work with Santa Rosa Community Health as the Chief Quality Officer. So I'm overseeing population health, quality improvement, and the nursing department. And I feel really, I've been doing this work for about 5 years, and I really love being here because it's sort of a combination of, it's the end of my career, and it's a combination of all the work in community health, and especially with Roseland. I was in the Roseland community for 14 years and then worked in public health, so for about 10 years. And so that's what I'm doing now, and I love it. Unfortunately, when I started at Santa Rosa, it was just 6 months before the fires, so it's been a bigger adventure than I anticipated. But still really amazing, wonderful people to work with, and it's been great. And I think that's the theme for me about working at on Roseland and the Roseland Children's Health Center and getting it open. And you can see the amazing people I got to work with Adrienne and Les, and then later meeting Jen and Julio and the others at Southwest, and Sister Michaela Rock as well. It's just been, it was almost being kind of a quieter person, almost overwhelming at times, not just all the amazing people I've met and the amount of energy is less described. It was a time of people who had so much optimism and feeling of excitement about what we were doing. And we really didn't have a really, like, probably now we would have had to have a much different approach, but in those days we were just playing it by ear and going day by day. But it's just the overwhelm, it was a positive overwhelming, was not only these people who I got to work with on a daily basis, but was all of the volunteers that stepped up to the plate. I mean, so many people that would call and say, you know, hey, I heard what you guys are doing. What can I do to help? So there were a lot of physicians and nurses and people who wanted to raise money, fundraise. And it just, I'll tell more later, but that was really the main part. So what was my question? I'm sorry. You want me to tell, oh, how did I meet the people at Southwest? So
Yeah.
at the same time, there was, I think there was it was called a Healthy Start grant or something that came out of the schools and community action, what was called SCPEO at the time, which was all about collaboration and establishing community-based collaboration and community organizing. And so the families were involved from the very beginning, and there were a lot of people who were looking to figure out what we could do. And so through those networks, we also heard about what was going on at Southwest. So Adrienne and I were, you know, focused on the school community, and there was actually 3 school districts that we were focused on: Bellevue, Wright, and Roseland together, because there was a consortium, and the families that were involved there. But in that process, we heard about what the Southwest Clinic, and wanted to make sure that we were all working together and well aligned. And so I don't know if they heard about us at the same time and who reached out to who. I don't exactly remember anymore. And I suspect that Sister Michaela was a part of that connection, because she was really great at connecting people. And when she heard about things, she probably picked up the phone and called one of us and said, hey, what are you guys doing? This is what we're doing. So that's what I remember.
Mm-hmm. That's great, Elisabeth. And we're gonna come back on that, your fundraising talents later. So Jen,
and building.
yeah, Jen, you know the routine on intros. You know, tell us what you're up to these days, and a little more about your connection at the time. And we've heard a lot about all these amazing things that started to help make it happen. Were there moments when you weren't sure? Like when it was a nail biter, you weren't sure you're gonna make it.
Yeah. So briefly, so Jen Hastings, also one of the residents, and now, and gosh, Julio, how many years have we been together? But yeah, so the 6 of us, and then shortly thereafter, Steve Sharon made us 7, and we named ourselves Amistad Medical Group, friendship. And I think Julio reminded us when we were just prepping for this call last week that really friendship and the heart was really the core of our journey together, both to, you know, the 6 and then 7 of us, and then with everyone we interacted with. But when Julio and I left Santa Rosa, which was unfortunately 1998, I went on to be at our local Planned Parenthood here in Santa Cruz, and I focused on reproductive justice, became an abortion provider, and also piloted transgender healthcare starting in early 2000. And that's really been the core of my journey, is transgender and gender expansive healthcare, along with mindfulness and medicine. And I'm very grateful for the path I've been on. And so I'll just briefly share the core of my work initially was kind of getting the Kaiser and the Sisters of Orange and the residency to communicate with each other. And our vision initially was that all 3 entities would support support our community health center. That ended up being too hard to make happen. And there were moments when I really thought we were not going to make it. But Sister Michaela Rock was a force of nature. There's no question. And she really, she got us. And we, yeah, she was just an extraordinary human. We had our moments, our challenges with her, but in basically she is what allowed us to move forward, really, by providing the financial support. And my role was very much concrete in the sense of trying to get the clinic open, the Lombardi campus, and doing writing all the protocols and all that kind of stuff, and making sure we passed the inspections. But my other big role was with Adrienne and Elisabeth in the Roseland clinic. And my heart is just still so incredible to see Adrienne and Elisabeth and Les, and I think of Helga fondly. And it was really an extraordinary time. And I don't know who will tell the story of how we got our little clinic, which was a mobile home that a contractor donated. And I mean, just little miracles all along the way that made this thing happen. And I'll just I don't know whether I'm going out of order, but the opening of Lombardi Campus, I just remember as strawberries and whipped cream, because we had this little joke with Sister Michaela. Would it be that Maceo, our first child, would be born before the clinic, or who would come first, the clinic or our first kid? And Maceo was already almost a year old. And I remember his face like covered with strawberry juice for that opening of the Lombardi campus.
Yes,
That's
I remember carrying him and doing tours
Right.
of the rooms while holding on to this 1-year-old or close to 1-year-old.
Yeah, not quite one. Yeah.
So great. So great. And this is wonderful. We had a couple of people join us. Mary Maddox Gonzalez and Dr.
Mary.
Gonzalez. We're so glad you're here. We got you in. And yeah, we want
And Ben Brown.
Yeah, and Ben Brown. And that's exactly, we want to take a pause here and ask people to shout out kind of what's jumping out at you. What are you wondering? Or what's a story that maybe you remember? Ben or Melanie or Jay Dean. I'll call on you. Raise your hand. I'll call on you.
Dean. Yay, Jay Dean.
You know, since we're going back to the beginnings, I was right there. You know, Sister Michaela just corralled us. The original board, she had her ears to the community. She corralled about 10 of us. None of us had any experience at all with being on a health center board. But she said, we have, and you are the ones. And so we sort of sat there with our eyes wide open, but we knew this was a good thing. And we had a lot of growing pains. We went through, I can't tell you how many executive directors in the first few years. It was a difficult thing. We didn't know if we were going to make it. We always had financial difficulties because the people we were serving didn't have insurance, and we didn't know where we were going to get the money. And thank God for Naomi is all I can say. I don't know that the health center could be in the position it isn't now without Naomi. And she became a board member originally, and she had had a lot of experience, and we were so glad to have her on the board. And then we lost our ED, and the board was sort of futzing around saying, what are we going to do now? What are we going to do now? And we sort of thought, well, you know, Naomi might be a pretty good person. Let's see if she would consider doing it. So I can picture right now still meeting her over in Sebastopol and asking her if she might consider being the executive director. And she thought about it, but not for that long. I think she saw this as a really new challenge for her that she could embrace and switch gears to serving the community, which had not been her previous focus. And it just warms my heart to see what she has managed to do, along with everybody else too. But I think her leadership and her vision and her tenacity have brought the health center to where it is today. And it just, when I think about back to over 25 years ago, before we opened and we were going through all these growing pains saying, oh man, I don't think this is going to work. What are we doing? You know, without Sister Michaela, it wouldn't have happened. But, you know, all the people over all the years have just been phenomenal. And it just warms my heart to see it all, to see how wonderful it's been. The whole health center, now it's not Southwest anymore. We really struggled with the name and we said, okay, we're going to call it Southwest because this is where we are. This is the community we want to serve. And now it serves the whole city, and it's just wonderful.
Mhm. Thanks, Jay Dean. Thanks. I'm so glad to hear that story. And I heard Mary and Enrique, you were unmuted. Is there a little story or anything that you want to share?
First of all, thank you very much for doing this, and so nice seeing you guys. What I remember is that Julio and I worked together very closely when he was a resident. I was his advisor, and it was so easy to advise him that usually I advise him going to have lunch and a beer, and or dinner and a beer, and it was so nice. At that time, I was working as a faculty at Alianza, and I was seeing patients coming far away from Santa Rosa, of course, and I think Petaluma, and I remember telling Julio, you know, when you graduate, maybe you can do a clinic. It was just, and they did it. I was so amazed. I didn't do anything, but, and then working at the clinic was such an honor. And working at LCL, and it was such a beautiful experience. So I only have wonderful memories. It was not easy for anybody, but I think it was not easy for the administration because there was no money. And our patients, unfortunately, didn't have how to pay. So it was challenging, but now I think it's a model for the entire California and probably for the entire country. So I'm so proud of being a little part of that and seeing you guys. Oh, Jennifer, Julio, my love to you guys.
Same
Thank
here.
you.
Can I jump in, because I have like a flood of like little memories here. First off, just Jay Dean, I so remember meetings at your house before this health center ever opened, with either paper plates, just having, you know, talking about what to do. And even before then, I think part of the vision of getting the community involved, I remember us going to PTA meetings, and, you know, they don't teach physicians to play well with others. You know, they kind of, you know, they train us to just like, go ahead and just do everything yourself. And so these were like completely different muscles that we all kind of learned to do with each other. You really cannot accomplish something like this without everybody involved. A quick Elsie Allen story. I remember Elsie Allen High School had not opened yet, and they suddenly needed like dozens and dozens of school or sports physicals. So I remember doing sports physicals on desks, like school. I mean, it was completely barren except for like the minimal kind of equipment. And we just found these like side rooms to bring, and just this long line of, you know, teenagers waiting for their sports exams. And then the last piece is just, you know, on the physician side, we had no idea what we were doing, right? I mean, we were just, we were inspired by these stories, and we came back and we were all inspiration and vision, and we had no idea how we were going to actually accomplish. So we actually hired, and just wanted to mention, because they were really, really important in the making of the clinics as well. We hired Cynthia Solomon and Heidi Stovall to teach us as much about managed care and how to get clinics going. as much as possible. So we would, be residents, second-year residents, do our call, and then after call, we would like order pizza and meet with Cynthia and Heidi and find out as much as we can about the business side. And just to end that story is, there really is something to be said. I think there had been a lot of talk for many years. We had heard in the residency, hey, somebody should create a clinic in Southwest Santa Rosa. There's a huge need for it. And nothing really had been done. Sister Michaela Rock really was a fundamental piece of getting all of this done. And, there's something to be said about being the only, if you do surfing, because we're in Santa Cruz now, being the only person on a surfboard out when the wave of money and community action comes. We were the only surfboard out there. I mean, we were full of inspiration. We had created some structure. And then the community and Sister Michaela and all these amazing forces just coalesced to help and make this happen. So yeah, I don't know if we would have done this if we knew how much work it really was. It was crazy. It was absolutely crazy. Thank you for not talking us out of this, Enrique and Mary. You guys probably thought these guys are crazy. And we were, but it happened anyway.
Crazy good. And there's truth to that statement. Ignorance is bliss. It helps you get on the surfboard and paddle out. And then, like you say, you were there to meet the wave. Melanie, I saw you turn your camera on. You might have a little story to tell. And I see Steve Sheeran joined us. And then we have some questions that people submitted as well that we want to share with people. Melanie.
I'd love to share a little bit. I just wanted to shout out a few names of people who were important to the history. I started in 2005, so it was sort of the next wave after you original founders started it. And back in those, and I was the director of human resources in those days, and it was the time when our leadership team consisted of Naomi, Ben Brown, who's here tonight, Cindy Dickinson, Richard Duffin, and Rory Gibbons Flores, who I see just tuned in, and me. And we were the leadership team. And now the leadership team doesn't even fit in a room. So it was a whole different world. And one of the things I wanted to mention was in the 15 years that I was there in human resources, we would do surveys of the staff and staff satisfaction surveys. And one of the questions that was always on there was something related to what matters most to you about, or what you love most about your job. And in all of those years, the top 3 things that all the staff loved, and this is staff from facilities to medical assistants to call center to providers to operations, administrative staff, everybody. The consistent 3 things were patients, other staff, other employees, and the mission of the organization. That was always so consistent. And I'm so moved. I was always really moved by that. And I would always tell that story at new employee orientations, because that's an amazing thing to have the staff, all of the staff, so consistently moved by and dedicated of this organization and loving each other as fellow staff and absolutely adoring and being dedicated to the patients. So I'm so happy to be here tonight and seeing so many familiar faces, and it's just the most amazing organization. Thanks, Anne Marie, for hosting this, and everybody for being here.
Yeah, super glad to see your face. Steve, I see you've got your camera and you want to get on this love train?
Yes, yes, I do. First of all, I really miss, and I want to say a big hello and brazos to Jennifer Hastings, and of course, Julio Porro. We miss you both, and I'm amazed you're retired. Julio, you're so young, but good for you. I remember working at the clinic with Jen and Julio, and Jennifer at the time was always behind this closed door, and there was a swooshing sound coming from there. Now she probably knows what that means, but I won't add any more to that. And then Julio, he did so much work as the first medical director. And one day he comes in, we shared offices. He said, well, I'm going to go to Santa Cruz. Do you want to be the medical director? So that was my push into the second medical directorship. But your legacy lives on, both of you. And I'm so glad to see you guys. Big abrazos. And believe it or not, I'm still working. So come on back anytime. And by the way, Julio, I know that backdrop is fake because my family was in Yosemite 2 weeks ago and there's no water in the waterfalls.
So it took me a while to get the swooshing, Steve.
Yes.
It was the breast pump, right?
Yes.
I was pumping. I forgot about
I can hear it down
I'm like,
the
what's
hall.
swooshing?
And Steve, you forgot that you were also a pediatric medical director.
I was. Yeah. Don't tell anybody. An internist is not supposed to do that, but yes.
Yes. When Jen left, for an interim period, we needed a medical director, and we were still separate entities at the time. But you were so kind to fill in the background, as long as I promised to connect you to a pediatrician now and then.
My pleasure.
When needed.
My pleasure. I'm still glad you're with the organization, Elizabeth. That's great.
Thanks.
Thank you so much, Steve. Mary and Enrique, you want to jump in? And then I'm going to engage some other questions that we have that people submitted before the event.
I just want to make one comment that it's just incredible to think back, just I see so many incredible people, friends, colleagues on the call, and to think back of, Julio, Jen, and Roberto and the whole group starting this, and Elisabeth at Roseland Children's Health Center, and what a tremendous contribution to the lives of so many people, and really seizing this moment to create these incredible resources. I mean, Santa Rosa Community Health is the largest community health center in between San Francisco and the Oregon border. I mean, it's just incredible. Some of the work I'm doing right now with Public Health Institute, we were holding out things doing that Santa Rosa Community Health is doing as national examples of excellence. It's just, you should all feel so proud of the contributions. Ben Brown, I mean, everybody on this call, just incredible work, and you just continues to give in our community, and we're so grateful. Thank you.
Thanks, Mary.
Anne Marie, before we go to the questions, there's just one story that I think has to be said because it's so unique, and it's the origin of the Roseland Children's Health Center building, and I think maybe Les may want to share in telling this story. But we were, as he mentioned earlier, our services were initially, it wasn't the Children's Health Center, but just school health services was being operated out of a little tiny room that used to be a bathroom, basically. And we knew we needed space if we were going to have comprehensive services, but we didn't really have the funding source for the space quite yet. And then Les, in his great way of letting everyone he knows out in the world that he needed a health center built on his campus, heard from the United Way that somebody, a contractor, had decided that he wanted to build something at the home show to demonstrate his work that he did as a builder, and that he wanted to donate this piece of a building somewhere. and where could he build it. And the United Way had heard of from Les that, you know, we were looking, and made that initial connection. And then it was really fun because we were all met together. How big is this little space going to be? How many exam rooms could we have? And went from there. So he built it over the weekend, over at the home show at the fairgrounds, and then he had to get it over to the school, and a foundation had to be built. And Les let the community know, the families know, if they all wanted to help build a foundation, they were welcome to come over. And so it was definitely, you know, a community barn raising kind of experience. And somebody knew someone with a flatbed truck, and they put this piece of a building onto the truck and brought it down Sebastopol Road. And with its roof the wires were too low, and so they had broomsticks pushing the wires up as they went under at 4 a.m. to bring it over. So there was a lot of, you know, interesting things that were going on.
Oh my gosh.
That started the building. And of course, it wasn't enough of a building. It was the beginning of a building. And so it took a couple more years to finish it, but it was completed by the Coast Guard from Two Rock as their community project. And they came out on the weekends and made the building much more usable as a health center. So it was really a wonderful thing to meet all those people, and everybody was part of this. So.
That's so great, Elisabeth. I keep hearing different pieces of the story. And Les, do you want to unmute yourself and share your view on that?
All right. I'm trying. Can you hear me?
Yes.
All right. Elisabeth, you have an incredible memory. Oh my gosh. I want to give a shout out to someone who passed away much too young, a woman named Rayleigh Thompson. Rayleigh did volunteer work for us, and she made this connection with the Coast Guard Academy down at Two Rock, and they made a Roseland clinic their major project. So we did our barn raising, and there were like 30 or 40 of these staff people from the Coast Guard Academy. So Rayleigh Thompson, whose husband Bob is a physician, retired now, but she was just absolutely awesome in the whole process. But part of that story, when they brought in this framed, it was just like a small frame of a structure, and the guy that built the building, his name was Stan Wall. He was a contractor. He had 4 boys, so he had brooms for his boys, and they boys were on top of the building. It was just like a wooden structure. There was no guts to it, and his boys were on 4 corners of this building with brooms holding up the wires as they drove the truck under. It was hysterical. I'm thinking, oh my God, if anybody gets hurt, I'm toast. I am toast. That was just amazing. And Elisabeth, she would come up with stuff. She would get doctors to donate all kinds of stuff. It was like a miracle. And like every time Elisabeth come by, it was like Christmas. She had gotten somebody else to donate something. She was amazing. So that was a fun story.
Yeah, I'm glad you brought it.
I would like to add too that I think, Elisabeth was so important, and Adrienne on getting us through with funding early on. And I'm thinking that, like we were just barely hanging on by our fingernails. And then when we got involved with Sister Michaela Rock and the hospital, it was just then this amazing relationship that, oh my God, they had so many more resources than we did. So this hard groundwork that we did, then by connecting up with the larger hospital and doing the larger clinic, it then assured that our clinic that we had started, this little one, would survive. And then together with the energy and the enthusiasm, it was just incredible. And I'd like to mention something to Julio and Jen that I think was really important, that I was so impressed that people cared enough that they were willing to put their time and energy into helping these kids. So I felt like I can't let them down. And I think that's kind of how we all felt, that we weren't getting paid extra to do any of this. But it's like we were all so committed that, by golly, if Elizabeth's going to do that, I can do this. If Adrienne's going to do that, if Jen and Julio are going to. So it's like we were all, there was a synergy and support that we really, really wanted to not let anybody down, and that we could do this. But it really, truly did take a whole team of us to do that.
That's so beautiful, Les. You know, we had somebody actually ask a question that ties right into this. We have one of a longtime friend, Barbara Moulton, has been a longtime admirer of Santa Rosa Community Health since the Lombardi days. And she also had a friend who became indigent, who received care at Santa Rosa Community Health for many months when he was in need. And she submitted a question and wanted to know, and I'm wondering, Adrienne, if you can speak to this. Was there a time when you knew it really was going to happen? We've talked about the hard times. Was there a moment or a story that jumps out when you knew you were going to make it?
It's so good that I am such a naive optimist, okay? Because it never ended. And my husband says, I am just so ridiculously naive. He says, I need to be more of a realist. But honestly, we believed, we had such a great team of people. That's what you need. You need people that are your partners, and you have to build those relationships. And we worked on it all the time. And I think we all believe so much that energy, and then all the folks over at Southwest, and then Sister Michaela and that group. And I just feel like it absolutely gelled. And I'm not sure, I just knew it. I think the story Elizabeth told, though, when I saw that building being brought into on a flatbed, and that we got people to donate everything from these adorable tiles for the floor and little tables and everything, like most gorgeous sinks and counters that no clinic could afford, but it just happened to be leftover, and somebody said, here, have it. And I agree with Les. Elizabeth was the most creative person in terms of identifying resources, but every little step along the way made me believe it absolutely was going to happen. And we came up against, I remember, Elizabeth, don't go into the details, I messed up with something with a fire hydrant. I'm remembering a horrible meeting with the fire people. I messed up. I didn't know what the hell I was doing. I come from public health, and I did open clinics, but I didn't know about school health and school nurses and all the laws. And oh my God, the notebook that we had to follow for the county to get licensed. So we really, just having that loving support and knowing we get through every step of the way, I knew it was possible. There was no way we were not going to succeed, but we had really unique people. I've worked with schools for many years. When do you get superintendents like the three of our consortium, and teachers and parents and community members who absolutely want to work together to make this happen? And in the most beautiful community. I came from LA. Southwest Santa Rosa was where I worked with CAP, and that I felt so honored and so lucky to be able to have worked in that community. So how could I not believe it wasn't going to happen? So sorry, I don't have one story. It's just, but I do remember when it was coming from the building, feeling like, this is really gonna goddamn happen. Oh my God. So anyway.
That's perfect. That's perfect.
I have to agree with Adrienne on our side, on the Southwest clinic side. I had no doubt that this was going to work. I think maybe Jen took on like a lot of the worrying, but I had no doubt that this was going to happen. And similarly, naive or idealist, but yeah. And I have to say, there has to be something either in the water or in the land in Santa Rosa to be able to draw such amazing human beings. I mean, Ben Brown and Elisabeth and Adrienne, and I mean, what brings Mary and Enrique, I mean, what brings people to this place? Because again, it's now a, amazing organization, huge organization. But the spirit has just continued. I mean, there's been more and more. I mean, I've gotten to know a couple of your previous leaders, Lisa Ward, amazing. Francisco Paco, I got to know through our leadership program. Beautiful, beautiful human being. I mean, how is it that folks are coming to Santa Rosa? It's a really, really beautiful thing. It's been passed on to just amazing hands of fellow dreamers and fellow folks who actually get stuff done.
Thanks, Julio. Ben.
Yeah, I wanted to say, it's so fun to hear the foundation and the people that helped to build it. I was medical director between 2001 and 2008, where we grew our patient volume over 5 times in those 6 years. And when I came on as medical director, I would say politely that we were suffering from growing pains. And just, it grew really fast. And, to give an example, one of the first changes I made was, we went from 10 referral forms to 1, okay? And, people were always just complaining about, where's that referral form? Where's that referral form? It's like, no, we're gonna have 1 referral form. That was an extremely popular thing. And, Steve was there, Enrique was there. And I looked at the provider group and I went, we have the most amazing group of providers anywhere. These are people that could work anywhere that they wanted, and they've chosen to work with the underserved. And, some of them came from private practice, some of them were just incredibly charismatic. And I said, if the providers decide to do something, we can do it. We can convince the whole staff to do it. And so what we did as a provider group was decided to change the whole structure of the clinic and change how do we actually approach it. And we brought our wait time, our patient wait time down from an average of an hour and a half down to 45 minutes. We totally redesigned the whole clinic, and we went from having people that were missing a lot of work. Our employee retention went up, our employee satisfaction went up, our provider satisfaction went up, our staff satisfaction went up, and we grew 5 times the size in approximately 5 years. Harvard was so impressed, they sent out a team to study us, and they asked, what is it that worked here? And, we looked around and we went, well, we all really like each other. and that was the, it's the magic that you're talking about. And as I hear it, it's like, that's what it takes. It just takes good people. And if we really like each other, like I have such respect for Enrique, such respect for Steve, such respect for the board, and Melanie and Rory and the whole leadership team. It was just amazing. And we liked each other. So we, if you like each other and you're working together on something that's really beautiful, you can accomplish amazing things. So I just want to say thank you to all the founders. You guys are awesome.
Thanks for jumping in, Ben. And we had another question from Patricia Kulabiak, who many of you know, one of our family physicians now at the Dutton campus, which opened in 2018. But she was at the Lombardi campus, and I'm wondering, maybe Jen or Elisabeth, you can answer this. She wanted to know, how did you cultivate your relationship with the community? You've clearly talked about you had this community support, and I see Rory is here. Maybe you want to jump in on this too, because I know you played a key role in outreach and engagement. How did you cultivate your relationship with the community? Did it take time for people to trust you? And how did the community respond when you opened the clinic?
Like, just briefly, I think Elisabeth and Les have already spoken to this, and Julio as well. Like, it was such a key element in both centers coming to be, all the centers, Elsie Allen, the Children's Health Center and the Lombardi. Like it was just part of it was an essential part of the coming to be. And then I think it just continued. And yeah, I don't know if Rory wants to say more for later on what happened, but it was an integral part of the creation. And so it had to continue to be a part of it.
Great.
Elizabeth? I think that's right. It was, there was so many ways that the planning happened. There was a lot of focus groups, a lot of, we had family advocates, Carlos Del Pozo, and can't remember the other, but who were out in the community that were talking to families, getting input. The staff at our Children's Health Center were parents, they were part of the community right then and there. That helped a lot. When we had our bit of a building up there before it was even open, it was an occasion for a celebration. And so I remember when Les had all of the kids in the school, all sitting in their chairs out on the, out in the pavement there, looking at the health center. And we had Lynn Woolsey come and have a grand celebration of what was going to be. And I think just all of those things that happen just keeps everyone excited and interested and has a conversation. And I just thought the kids were so excited about that there was going to be a health center right on their campus, and that, I think it meant something to them that people cared, and it was great.
I think early on, we were very popular with the local emergency rooms because they finally had a place to send patients who were not insured. Their responsibility is to make sure there's some referral to a private practice or to a physician's office. Well, when we opened up, we were that place for people who had Medi-Cal, which a lot of offices didn't accept, and also for the unfunded. So that's how our reputation started, as really filling that need. And then as time went on, we were able to ask private docs who felt some kind of obligation to help out. And I remember many of my friends, private docs, who would volunteer their time. Fritz Bohr in orthopedics would help us set fractures. Stephen Gosby, rheumatology, would see patients. Robert Richardson, general surgery, would do minor surgeries that weren't so minor in the office. So the community, the medical community, really got to know us, and I think appreciated us as time went on.
Thanks, Steve. And we got to meet the Gosby family. Just in recent months, and they're appreciating Dr. Gosby's commitment and with his passing, and such a testament to all these networks of connections. And Elizabeth, you mentioned Lynn Woolsey. I want to give a little shout out to Brendan Sweeney, who's with us tonight, because part of that community engagement and the network of relationships is also relationships with our governmental representatives, and Brendan's with Mike Thompson's office, and he came out on Saturday and did a little tour at the now Pediatric Campus, where we're doing the COVID vaccines for kiddos this weekend, and that advocacy is so important, and partnership. So thanks, Brendan, for being here. And let's see, I saw somebody, Mary and Enrique, yeah.
Yes, I just remember what Ben Brown was saying, and Steve, that how we grew. I remember doing my weekly program at KBBF and telling people, you won't believe it, but we have this clinic and wonderful people works there. At a certain point, I don't know, it was Ben or someone says, we have so many patients and not enough providers, so maybe let's slow down a little bit. But I think it was such a group effort and such an amazing success that still, gosh, very proud that I was part of it.
Beautiful. And we have another little video from a friend of ours, Judy Farrell, who's here tonight with us too. And she's been a longtime friend and supporter. And so we want to play her video and then talk about that response. Lori Lynn, can you tee that up for us?
Hi, I'm Judy Farrell, a community supporter of Santa Rosa Community Health. And I was on the Capitol campaign for Building Vista some years back. My question is, tell me what were the key motivating factors for your tremendous expansion from one campus at Lombardi all those years ago to the tremendous growth you've had in serving the Santa Rosa community. Obviously demand, but you've really done such a great job of identifying needs in the community, like the school-based clinics and the dental clinic. And I just was interested to know what were the motivating factors for your expansion. Thanks.
That's great. Thanks, Judy. And that ties right in with some of the things we were talking about. And so I talked to Naomi a little bit about this morning, and others of you may be able to comment on it too. And she already spoke to, how the founders had really established this set of values that were the guiding star. And one of those was being responsive to the community that we serve. And so from her perspective, the growth was always really based on what does our community need for improving their health, but also improving health equity in the community. And so, for example, like merged with Roseland, had Southwest merged with Roseland when they realized Roseland had outgrown that location. And there was just such a tremendous need. There were so many kids who needed care. And this has also come up before that from a business model perspective, some of the health centers that became a part of Santa Rosa Community Health, they weren't federally qualified health centers. And so couldn't leverage the reimbursements and the government, the grant funding that was available to Southwest. And so it seemed like a great resource. Again, that let's leverage resources to have greater impact to expand what's available for the community. And I'm wondering, Ben, you spoke to some of the growth, and Steve, do one of you want to comment on that as well?
Yeah, I think I would just say in 2001, we could have built the same size clinic right next door and filled it in one day. It was just an extreme need of the community. And I think Enrique spoke to this really well, that it was like, no, we don't need any more patients right now until we can, grow. And I think we grew as fast as we possibly could to meet the need, and even faster than we could a lot of the time. And one of the things that people probably don't know, the hardest thing in healthcare right now is recruiting providers. And part of what we did a really good job of doing, and I think a lot of it was because so many of the changes we made, the providers were the leaders on, and they had a lot of say in what we did, that we created a place that was very attractive for providers to work. And so we didn't have that same issue. Plus, having a residency in the area makes it a lot easier. And part of the motivation for making sure the residency survived, because it was going through some rocky times before we took it over, was so that we would be able to recruit providers. Because if you don't have providers, you can't provide health care. And so I maybe some of the other folks can speak a little bit to that. But making a place that's really, really fun for providers and for other people to work, and that's doing really good work.
Right. Yeah. Julio.
Yeah. I have to say, I mean, first off, just the amount of work that Sister Michaela Rock was already doing in the community, sending folks from, I guess, community benefits division, sending folks out and starting to build, I think, issues around going out to the community, meeting people and finding out what were the most important things in the community to build. So that was an amazing amount of foundational work. But I'd say the initial physicians and with Sister Michaela, we initially were thinking now it's called integrated behavioral health and all of the community health centers that already have dental clinics or expand to dental clinics. Back then, we were thinking 25 years ago, we were thinking along the lines of one-stop shopping. That was the key word that we kept throwing out. Oh, we want our patients to be able to go to one place and get their medical, dental, and psychological services. And we had no idea that a community health center could actually have all of those services, but if we just had it in the same place. And then I remember sort of having the dental director kind of come over and grab me to look at some stuff and vice versa, and talking to the psych person, could you see this? Can we get this person to see you? So that was certainly an important piece. I had, and I think Jen as well, had interviewed in Seattle's residency program, which has the CMAR program, where residents actually go out to community health centers and do their outpatient rotations at FQHC. So in my mind, yes, we want to have one-stop shopping. We want to be the community health center where residents come and get an experience. We also saw ourselves as this hub. We were thinking of doing ultimately, hey, if Roseland Clinic, well, every elementary school and every high school in the area should have a school-based clinic and serve as a feeder clinic to the Lombardi court. So we were already kind of thinking about how to expand it back then.
I think the financial reasons for the question is the expansion. And to go back to something Les Crawford mentioned, all of our support, totally 100%, was through the Sisters of St. Joseph until we got our FQHC. And there was a point where the sisters were not going to pay our rent after 5 years and salaries. And so we almost went broke, closed the doors until we got our FQHC. And Naomi Fuchs had a big part of that. But once we got our FQHC, we were able to get federally funded money. And then we were able to expand, and we were able to support other satellite agencies and help them, and they became part of us. For instance, the LC Allen High School Clinic was then part of us, and we were able to support that. Friends House had a program we were able to support. Turning Point, we helped by bringing them into our FQHC umbrella. Dental clinics, House Calls program, another Sister Michaela Rock program. All these programs were able to be helped because of our status with FQHC. So to me, that made the big difference.
That's great. Thank you, Steve, and Julio, and all of you. Yeah, Elizabeth, do you want to chime in too?
Well, I was going to say, and Roseland Children's Health Center was helped by you being established as a FQHC. And because before then we had like the Sharing Our Hearts, the Medical Association Alliance doing luncheons every year. That was how we were making ends meet, and other small groups of people that were raising money, 20 women and different people like that. So it was really wonderful that we could finally join the ranks of an FQHC. A big part of why Roseland is still open now.
Okay, Elizabeth, you have to tell the story of the 20 women.
Okay, so yeah, we were at a point, I'm not sure exactly what year it was, but it sounds like not such a big deal, but at the time I was told, okay, guess what? we're really short of money. And if you don't come up with $10,000, within a month or two, that's it. You're going to close down your doors. And so basically I was talking to some friends and I told them my worry, and she said, well, do we know anyone that we could ask for, $10,000? And I'm like, I don't know anybody who could give us $10,000. Do you? And she says, no. And then we were like, well, what if we ask do we know 10 people who could each give $1,000? Like, no, I don't know anyone that could ask for $1,000. And then finally we broke it down to, well, we probably each could find 10 people each. That would be 20 women who could each give $500. And however, we would tell them, we would set up a system where we would invite them all to dinner, and they would generate ideas on how to raise the $500. And they all had ideas. Like, some people baked pies, some people did jewelry sale, made some jewelry, they found their crafts, whatever they did, and they each raised $500. And then we found a 21st woman who said, look, whatever your group makes, I'm gonna match it. And so it was really exciting, and that group hung together for several years, raising money, and they raised way more than $20,000 a year. Some years it was up, but we would invite them after they would have this time period to go raise the money. We would invite them on a day. We had a deadline. They would come back. We would cook dinner for them, and then we'd have a counting the money party. And everyone brought their envelopes with their cash, and they'd empty their cash into a big bowl. And we would count all the money together with an old-fashioned calculator. And I would put it in an envelope and stick it under my pillow that night, because it was in the evening. I couldn't take it to the bank. And that's how we did it. So, yeah.
I love that story, right? It just ties in with every theme that we've heard tonight about belief and connection and innovation and dedication and creativity. And so, all of you have had just such remarkable careers. That's kind of when you look, you might not know where you're going when you're looking down the road, but when you look in the rearview mirror, you have a sense of just what you've accomplished and maybe lessons that you've learned. So, we're gonna share this video that's being recorded with more of the residents and staff who couldn't make it tonight. So I'm curious, what lessons have you learned as a result of starting the health center or over your career? Or what advice do you have for people who want to make a difference in the world today? So let's maybe start with our founders, and then there are others of you who have had made such contributions who've all been a part of this founding. Who wants to go first? Jen, Julio, Elisabeth? What lessons have you learned, or what advice would you give? Les?
Well,
Jen, you go, and then Jen, you
sure.
first, and then you,
Just
Les.
really quick, and I feel like this is we could all probably talk for several hours on this, but for me, it really is moving from heart to action and just going for it. So I think the activism-y part of me, that I think going from a dream to actually brick and mortar was a very powerful experience as a newly graduated resident. And that really has been my path since that time, is to create, if something's missing, I create it. So the transgender healthcare program, mindfulness in medicine, integrated behavioral health, all these things I really brought to Planned Parenthood where I was working because it was needed. And I never, ever thought, oh, I can't do this because it's too hard. It was always like, you just pull the people together. And I think what Ben said is, like, when you move from your heart and you love what you're doing and you love the people you're working with, miracles happen. And people can look at stuff and say, how did you? And it was almost effortless. Yes, it was hard. And yes, there were times when we didn't think we could, seemed impossible. But I think the heart is really a powerful moving force.
Beautiful. Thanks, Jen.
Thanks.
Les, unmute yourself.
Okay, there, I did it.
What advice would you give, or what's a lesson you learned?
I think when you have a commitment and a passion to do something, and then you follow through and you do it, and that every generation, every period of time has its challenges, and it's just, what are those challenges? Pick something and then do something. You can't fix everything, and if you just whine and complain, nothing changes. Pick something that you're capable of making a difference in. You know, I can't change what happens in Washington, D.C., but by golly, we changed something in Santa Rosa. And so that would be my encouragement to folks, is try to identify something that you believe is important, and then go for it, stick to it, do it. And that's like a lot of different people in a lot of different places, picking something that's important to them, that's useful and beneficial to people. And then it's just this building block process. We get to make a difference that way.
So true. Les, Adrienne, Julio.
Yes, thanks. I was thinking about how much my whole background is nonprofit work, community clinics, and before I went to Kaiser. So Kaiser, definitely, it was shocking. And when I went to Kaiser, I was in shock that we didn't have a lot of people that were involved in all of our amazing community groups throughout the county that did lots of different things. And I had done a lot of work with the Teen Health Advocacy Coalition, which one of our main founders is right here, Mary Maddox Gonzalez, who really got us going and really brought it into the community and connected it to the residency program. So one shout out to Kaiser is they let me continue to be in these collaboratives, and that's the way I got to keep working with Santa Rosa Health Centers, is doing this work in the community. But the thing I think that in my nonprofit work, and that I learned at Kaiser, because it was tough going to a big institution that wasn't particularly nonprofit, and is I think I just believed it doesn't matter if someone tells you no. It really doesn't matter. You're very kind, you say okay, and you keep working at it. And I just never take no for an answer, but in a respectful way, you just say, okay, that's one response. What's a different angle? How else can I get it? And that's how I really believe I got to do community work at Kaiser, which the Patient and Family Centered Care Program is so about public health and community work and partnership with patients and collaboratives. Is you just hang in there and you know what you believe and you know what's right. What is right? Keep moving forward and find your allies. And it wasn't hard to find the allies in the community. And at Kaiser, I found my allies, and I do want to give a shout out to our administrators there who allowed us to do that work. But it had to be someone coming from the community, educating them and talking about, this is important. This isn't typical of an institution like this, but let's look at it just like we had to do. I mean, most CAPs never had experience developing health programs. We were already rare that we had a family planning program. To take a community action partnership of a community action agency and have that evolve and develop health programs was incredibly difficult, but unusual and possible. And so that's just a lot of my learnings. And a lot of that helped me really succeed and grow at Kaiser. So thank you.
Wonderful. Julio, you want to go next?
I'm gonna come from a really strange direction at first, and then hopefully it'll make sense. So what I learned the last 4 or 5 years as I was medical director of quality at the Alliance, at a Medi-Cal managed care organization, what I learned was to be the one who chooses and creates metrics. So I wanted to be there when metrics were chosen and or created, because I think healthcare folks we oftentimes are like little Pavlovian dogs. You wave a metric and we jump up to get 100%, right? And what's really, really key and that I've come to learn is that metrics have souls. They have the metric itself and how you get to the metric can either foster togetherness, compassion, love. If anybody doesn't know Avidus Donabidian, look up Avidus Donabidian, who was the father of quality in medicine. He was an Armenian, turn of the century, came to the US, did a lot of quality stuff under Deming. And at the very end of his life, they asked him, what he had learned around process and execution and all of that. And he came up with like something very nerdy sounding, like efficiency is really important and da-da-da-da-da. And then at the very end, he said, but ultimately, the essence of quality is love. That's what this quality nerd came up with after his 90 years of doing stuff and executing stuff, is coming really, it's all about love. So I would say lead with your values. I think that's the most important thing that I've learned. Know that folks are looking at the metrics, be real, be practical, but don't get lost in the metrics or the acts themselves. Make sure that the metrics and the acts that you're doing really are encompassing the values. I mean, Steve Sharon, Ben Brown, they're amazing physicians. They learn to be really great physicians, but what makes them truly extraordinary doctors, their special sauce, is that they retain their essence and it exudes in everything that they do. The fact that, Ben Brown could do anything and he would still bring that amazing love. Same with Steve Sharon. So not getting lost in the role, learning the tricks of the role itself, but not forgetting who you are or bringing it into what you do every day.
Such a beautiful, beautiful reminder. And I want to, Elisabeth, I'll invite you, and I want to shout out, we've had a couple of comments too, and people joining in with their thoughts, because I think it speaks to that. So my partner and colleague, Griselda, is here, who some of you may know, and just speaking about what an honor and inspiration it is to be a part of doing this work and carrying out the vision that started it all. And Griselda has shared with me her history when she arrived at Santa Rosa, that Southwest was her medical home. And she remembers feeling so welcomed and cared for as a little 8-year-old. And then it became her place where she volunteered through TAG, and now is her employer. And she's grown up and continues to grow through the ranks and working alongside so many of you, and gives a little shout out of her thanks here in the chat. And Dr. Irene Balut also talking about learning the impetus to start the clinics and hearing the stories and the laughing and the connections. And we're in a different world today, she says, with technology and quality, but and data-driven population health, but it's the stories that really continue the great seed work and help us keep going, right? That heart is, like you said, is a powerful force that keeps us going. So Elisabeth, have you got a lesson besides us needing to get your quality team t-shirts? It says the essence of quality is love. I see those in the future.
Okay, thank you. Yeah, that would be great. So yeah, I have to agree with everyone. A big part of it is just really believing in what you're doing and not giving up. But also I think of problems as opportunities to find answers. And that's always so exciting when you find an answer to a problem. And so that kind of keeps you going. But I think the biggest lesson I learned is to be so open to all the amazing gifts that people bring to a situation. Over and over again, I had people call and say, you know, I want to volunteer. I was thinking about Jean Porter, who was elderly, and she heard about it, our health center, and she wanted to knit hats for the children. But I didn't have a need for hats that are knitted. But as I got to talk to her, it turns out she's a wonderful children's photographer. And she would come to the health center and take wonderful pictures of the children. We used them for fundraising, but we also gave them to the families who not always could afford a professional photographer taking pictures of their kids, and they were so grateful. And that started a lifelong relationship with her. You know, she passed away recently, but and well into her 90s. But just all of those, I have more I could tell you all night, all the different people, but just that contributed to the health center and also just to my life as a person. And that's what keeps me going. So.
Beautiful. So are there others? We're kind of coming into our closing time here. Bob, as one of our board members, I don't know if you want to chime in with a story or something that's jumping out at you, a lesson.
Well, certainly not necessarily a story or a lesson as much as what a wonderful experience I've had being part of the clinic now, probably like 15 or 16 years. And Ben, it's wonderful to see you. I don't know where you've been, but I'm hoping that you're back now, because I put off all medical care until you get back.
No pressure.
I think the thing that I take away from the clinic kind of constantly is the continuity of the attitude, regardless of how much time folks spend at the clinic. Sometimes it can be just a few months, and other times years. We maintain a really nice continuity of attitude, and that continuity of attitude, I think, allows anybody that's worked at the clinic to feel welcome. It's almost like the clinic is really a family, and everywhere you turn, you see new members of the family, and sometimes family members leave, for short periods of time, but whenever you bump into them, either inside the clinic or outside the clinic, there's this really nice sense of emotional continuity, and I think that's what keeps me so locked into the clinic myself. I never feel like I'm not part of the clinic. I always feel like I'm part of it in some way, sometimes actively, sometimes passively, sometimes in a public relations way, but I'm always part of the clinic. I'm so grateful for all of you to take, this evening to share your experiences. But for me personally, it's wonderful to hear from, kind of the founding members, what your passion was like, and it's nice to know that it's still here.
Am I unmuted?
You are, Les.
So I want to say this. I am so struck by the importance of people's connection to people, and that for younger people, technology is pretty cool, but by golly, what we have seen here over and over again is that the people, the personal connections have been so powerful in making so many good things happen. And so younger people, use your technology, don't become a slave to it. That those interactions with people are so important and so powerful.
Yes, I saw Jen. Yes, Enrique.
Yes, I just want to remind us the residency program, how important it has been. But first, I want to tell you, I read this somewhere that to achieve a dream, you need a great capacity to dream.
Yeah.
You have to believe in the dream.
Yeah.
working at Alianza and a clinic that John Durbin, our beloved John Durbin, started many years ago with some residents, and seeing how all these clinics been basically having former residents working and making these clinics possible, makes me feel wonderful being a graduate from there.
Beautiful.
And it's finally the health center that allowed the residency to continue in
Absolutely.
a very difficult period of time.
Mhm. You know, Mary, I can build on that and just add a couple of, well, I'll say two things. One, this evening has given me totally new insight into Elisabeth's incredible skill following the 2017 fires and setting up the cans and vans, as we called them, to help serve our patients, the clinics in a can and the mobile vans, and how they appeared from different health centers. It's like, oh, she said she didn't know anything about this, but actually apparently she does, because she got a mobile home carried on a flatbed truck to Roseland however many years ago. So that's one. And in terms of the residency, it was similar, that in that same time period of prioritizing in this time of unprecedented, unimaginable crisis, that all of the care needed to be shifted around to make it possible for the residents to meet their commitment, so they could continue meeting their requirements for graduation. So just another example that builds on all of these stories that we've heard. Steve, do you want to jump in with the last word, and then I'm going to invite us to a closing?
Oh, I don't want this to be the last word, but before everybody disappears, I want to say hello and goodbye to Jennifer Hastings and Julio Porro, and I'll see you guys in 5 years.
Great.
Or sooner.
Hopefully sooner.
Hopefully before
Sooner
that.
than that.
Yeah, it must
I
happen.
say sooner.
It must
I
happen
think
now.
we're due for a trip. We'll come up and visit.
Business is in your house, I've heard.
We have to do this before 25 more years or I won't be here.
Not too many of us will.
Yeah. So there's something that that Lori Lynn and I like to do when we organize some other groups, and that's to close with just kind of taking a few seconds and checking in with your heart and your mind, and just thinking of one word about how are you feeling now, and we'll share it with each other. And we'll exit with that. But first, before we do that, I want to express just so much profound gratitude and appreciation for everything that you've done, but even more so who you have been and who you are, and how that has made all of this possible. And for the hundreds and thousands and literally hundreds of thousands of people who have been impacted over the course of 25 years in this grand adventure that we're all participating in. So thank you. Thank you for being here tonight. And I'll do the tic-tac-toe Hollywood squares and invite people to just share your one word, and we'll leave with that. And Les, let's hear your word.
Inspired.
Inspired. Beautiful. Jen.
Heartful connected.
That's two, Jen.
I know.
Elizabeth.
Hopeful.
Hopeful.
Oh,
Adrienne.
Sorry, Les, I'm doing two also. Grateful and in awe.
Julio.
Adrienne took one of my words, but I'll just use it again. Grateful.
Good. Mary.
Can I be non-compliant? I'm going to say river. When we're talking about the residents, remind me, Rick Flinders always said it's a river. It's a history and it continues on into the future. And I think it reminds me so much of Santa Rosa Community Health. We've seen how it begun. We've got you, Griselda, everybody else. It continues on into the future. So very grateful for that river.
Beautiful. Steve.
Quality.
AKA love. Jadine. Or who else will unmute?
I'm going to use grateful also.
Thank you. Ben?
Just feeling the beauty and the connection, and the simple word would be love.
Thanks. Good. Bob?
So this new supply chain.
Centered.
Centered. Good.
Oh.
Carla Longchamp.
Oh, I have to go with inspired. I am so amazed at everything I've heard tonight. So thank you.
Love you, Carla.
Great.
Love you, love you.
Let's see. Bob, Melanie.
Art.
Enrique.
Legacy.
Nice.
That's a good one. That's a good one.
Yeah.
James. Can you hit that little magic unmute button so we can hear your word?
Community.
Community. Great. Irene.
I'll also use now 3 words: love and measurement.
Wonderful. Let's see. Who? Brendan, have you got a word for us?
Moved.
Good. And Carolina.
Grateful.
Grateful. Miss Lori Lynn.
I love when I get to go last, which is always when you do this game. And it's overflowing.
And you're not quite last because I'll go next. I think we've gone around all the squares. I'll go next. I'll say heartened. Heartened.
I like that.
Yeah. So
Nice.
it's hard. It's hard to leave when we're having this warm, fuzzy space. But let's.
Oh my gosh, yes.
After party at Elizabeth's house.
Pack it up.
That's right.
Come on over. Pizza. Yeah.
I can come up with $500, Elizabeth.
Oh, thank goodness. A reunion party will definitely be in order. I see emails and arrangements coming in the future. And thank you so much.
Thank you, Anne-Marie.
I'll do this thing.
Thank you
Have
all.
a wonderful night. Be well.
Love you all.
Thank
you,
everyone.
Take care, everybody.
Gracias.
Blessed be.
Love and kindness to everyone.
Bye.
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 Wonderful.
Oh, thank you.
Good.
This is like leaving summer camp. I don't want to go home.
We're going to start making you make lanyards, Les.
So nice to see you, Les.
Oh God.
Yeah,
Oh, gosh,
wonderful.
Yes. I just feel so good. I am so full of just good feelings now. Thank you, everyone. Thank you for your wonderful work.
And beautifully
all the-
organized. Thank you. Really